If you take something like ibuprofen, upset stomach, GI upset and everything is a side effect. It's number one, it's really not going to kill most people. Number two, a lot of times those adverse effects can be ameliorated by taking it with a full glass of water rather than just taking it and taking it with a sip of water. So there are other things that can work around with it. There are times, let's say in a hospital situation, where we're required to give drugs that patients are going to have negative reactions to, but in those cases they actually need to be in a hospital so that we can have resuscitative measures in case they're doing them. There are times, again, from an infectious disease or immuno standpoint, where we have a bug that this patient has. There's only one drug that this is going to work with, and this patient can't take that drug because they're anaphylactic to it. There are ways of working around that, but they need to be hospitalized in order to do that.
Can I ask in the interest of moving this along, because there are other speakers and the program for time limited, if folks could hold their questions until the end of the entire, all the presentations, just write down what your questions are
and I'll be here long afterwards, so please feel free to ask me. If you do have adverse effects or side effects, get that information from either your physician or your pharmacist. Read the package information. If you do have any questions, as actually Heshi was saying, write the stuff down, and then the use of consumer medication references that are actually set up for lay people to read that information, and hopefully it's in a level that it's not going to scare people. Next slide. If you do have an adverse effect, make sure that you tell your healthcare professional about this, that you're either reporting it to your physician, your pharmacist, or whatever, and just making sure that they are aware of it, because some of these adverse effects can lead to much more dangerous situations later on. Next slide. Okay, over-the-counter medications. Over-the-counter medications are medications. I can't stress that enough. Most people, when you talk about medications, saying what medications you're on, they'll rattle off to me all their prescription medications, from their blood pressure, their hypertension, their depression medications, their anti-anxiety agents, whatever else that they're on. But a lot of people will not consider over-the-counter medications. These are just as important, if not more important, than the prescriptions that your physician may be writing, because they can negatively affect prescription medications that you're on. I'll answer your questions later, sir. We're going to be getting to herbals in a second. Use OTC medications only as directed on the label. And this is an important one, because if you take a look at, let's say ibuprofen, generic is the generic name for it, but we have Advil, we have Motrin. It comes in a 200 milligram strength, and the maximum dose from an oral medication for over-the-counter is a 200 milligram dose. But if you take 3 of them, all of a sudden, at 600 milligrams, that's a prescription dose. So be very, very careful on how you're taking these medications. And if you are taking these over a long period of time, most over-the-counter medications are for temporary use, not for long-term use. Okay, next slide. Anyone here a parent?
Hello, I want to, please, I have to leave. I want to say something quite important to you. Do you mind? Maybe one quick comment?
One quick comment.
Take 2 sentences. Do not use folk remedies, family recipes, or any supplement that anyone suggests without advising both your physician and your pharmacist. It is very important that people not use folk medicine for curing or in addition to anything.
I agree.
Excuse me, I really have to go.
Thank you for that comment. Okay, for those of you who have younger children, or if you're working with teenagers, just remember that infants are not mini adults. Dosing is going to be very individualized in those situations. Check all your prescriptions for medical conditions, and then when we're looking at seniors and we're looking at the more elderly and impaired population, a lot of times drugs need to be reduced, because either your liver is not going to clear them appropriately or your kidney is not going to excrete them as much. So a lot of times what you can take when you're 35 or 40, you're not going to be taking the same dose or the same frequency when you're 70 or 80. Next slide, please. You know, all of your medications are working in the point that they need to be dissolved in your body if you're taking them orally. Just making sure that you're taking these with a full glass of water possible. And that's going to reduce a lot of the risk of side effects. Because most people, what they'll do is they'll take a tablet, they'll take a swig, just like that gentleman's doing right there, right now. And these drugs tend to lay in the stomach. So what you want to do is making sure that you're giving enough water or enough fluid or enough food to buffer the medication, number one, and number two, to make sure that it dissolves completely so it can get more rapidly absorbed. Now, I've already mentioned that you want to make sure that whether you're taking this with food or whether you're taking it with something else, and take a look again from a lot of our HIV meds or certain ones which you need to have a fatty diet in which to take them. And almost every medication really requests your pharmacist or your physician on whether you can take grapefruit juice. And there's an enzyme within grapefruit juice which actually prohibits the metabolism of some of these drugs. Go ahead. Antibiotics. Now, for those of you who have had any type of infection, one of the big things is, and actually Dr. Stern kind of talked about this before, but from another aspect, is that especially with antibiotics, people take medications until they feel better. A lot of medications are going to be chronic. So you're not taking hypertension because you don't wake up every morning and saying, oh, I feel my blood pressure's up this morning. You're going to need to take this even if you don't feel that your blood pressure's up. If you're taking an antibiotic, the antibiotics are regimented for a 7, 10, or 14-day course of therapy. You need to take not only until you feel better, but you want to finish that course because that microbe can still be in your body at that point. And if you stop taking the medication, number one, that infection can very easily come back. And number two, it may be resistant now to the antibiotic that you're working with. I've talked about refrigeration, and that's still stands. You know, if medications need to be refrigerated, keep them in there. Next slide, please. Now, I know this doesn't go for most people, but working in the women's health industry, there's a lot of questions on pregnancy and breastfeeding. So if you are a female and you are becoming pregnant or you're going to be considering it, just let the pharmacist and the physician know. Next slide. Immunizations are important. So again, and especially in an elderly population and an HIV population, you really need to talk with your physician about getting your flu shots and things on that sort. But if you're getting live vaccines, again, this is one of those where you can actually get the disease itself, at least for a period of time. So check with your physician before you give yourself live vaccines. And make sure that if you are caring for younger children, that they're getting their immunizations as well. And I think this is the last slide coming up. Natural herbs and remedies. I can't say enough right here. The federal government does not regulate herbal remedies whatsoever. So when you go into a GNC, you go into your dollar store, you go someplace, if this is a natural product, ginseng, black cohosh, anything on that sort, there is no regulations on there whatsoever. So it's kind of buyer beware at this point. And a lot of these drugs have nasty side effects with other prescription medications. So as the gentleman here very loudly pointed out, check with your physician and healthcare provider before using any type of herbal remedy. Next slide. I've talked about the medication profile. I've got a bunch of these with me today, so afterwards please stop by and we'll be either glad to give you one. The other big thing here is that if you are taking medications, you know, again, a lot of times we forget to take them. These pill boxes are really, really great to help people remind them of them. I have a bunch of those over here as well, so later on, stop by. And next slide. Ask questions. You know, the big thing that we have with pharmacists and with physicians is that we want to answer all of your questions. We may not know of everything at that point in time, so just schedule an appointment and come down with your questions written. Otherwise, you're going to go off on a lot of tangents, which we've done before. So do a follow-up if needed for any questions that you have about your medications. And that's it. I want to thank you for your time, and I'm going to be around later on. So please stop back and we'll talk.
Thanks, Wayne. Okay. Next presenter is Rosemary Daub, who is a social worker at Action AIDS.
Thank the last two presenters for giving us that great medical information and pharmacy information, which is kind of a good segue into what I'm going to talk about, which is how do you get the services that you may need at this time in your life. So